you said retinols, but I've heard that retinols don't suit everyone. Is it?
Ideally, honestly, if you ask me as a dermatologist, I
Yeah.
would anyways recommend that you should have a consult with a derm
With
and build up your routine. And then you get a general idea of how you want your routine to be, what products suit you, aapko kya theek lagta hai apne liye, and then you can kind of keep going with that. But so you're right, retinol doesn't suit everyone, but
Yeah.
technically, retinoids should be under prescription anyways, like with a doctor and doctor guided.
Yeah, I think this social media and every other brand making all these retinols and AHAs and BHAs, that we tend to get too
Carried
much
away. Yeah.
confused, and a lot of information is also not good. I think that
I
is
think
what.
so too, because what ends up happening is I've seen a lot of patients come with so many products. They've been gifted some samples of some, they've ordered some. They're so confused. उनको पता ही नहीं है क्या use करना है क्या नहीं करना है. पूरा face भी जला के आ जाते हैं कभी कभी, like irritate हो जाता है
Yeah,
skin.
yeah.
So it's always better to take some advice. But yeah, once again, on the topic of a retinol or retinoid, they can be drying, they can be irritating to the skin. If you want to start without guidance, once to even twice a week is a good point to start. And then you can gradually increase if it's suiting.
As you mentioned कि जला के आ जाते हैं, I also went. So मेरा face wash खत्म हो गया था, and I got some face wash in the PR package. मैंने check नहीं करा कौन सा है, तो मैंने निकाला and I used. In the second day, my whole face was red and it started flaking because I have a very dry and sensitive skin. And after all that happened, I checked, it was a high concentration salicylic acid face wash, so that did. And उसके बाद मतलब वो यूज करने के ऊपर मुझे इतना ज्यादा खर्चा करना पड़ा कि आई मेट अ डर्मेटोलॉजिस्ट एंड उसने इतना सारा क्रीम्स दिया, फिर शी डिड सम हाइड्रेशन एंड एवरीथिंग टू सेटल दैट आउट. And this was my first encounter with the jalawa gai, and the second encounter was retinol. I used retinol on regular basis for 3 days, and again that same happened. And then she said, "You don't use anything. That's better. You have very sensitive skin, so better." So I'm using Cetaphil ka gentle moisturizer and Bioderma ka thick moisturizer. I think these two I use, and I think I'm sorted. And what else you want to suggest me now?
Yeah, so you're the perfect example of someone that has kind of experimented with skincare
Yeah.
and ended up spending more
More.
money trying to fix it. And that
I
is
agree.
exactly what I'm trying to say, that may not be for everyone, but agar skin bahut sensitive hai, so it's always better to take some guidance and just understand that what would work and what wouldn't. And back to your question about what would suit you, peptides are great. So
Okay.
of course we should add some anti-aging. So peptides usually don't irritate the skin. They'll provide some hydration as well, depending on the formulation, as well as anti-aging. So that would give you a lot of benefits. Niacinamide also. Niacinamide tends to suit most people. It's not irritative. It has a lot of anti-aging, brightening benefits as well. So two things that you could incorporate into your routine along with the gentle cleanser and the moisturizer.
So after that, I'll write a prescription for you. So now let's talk about in-clinic expensive procedures.
Yeah.
I have to mention that expensive because they are super expensive.
Right. Which is relative, but
Which
okay.
is-
Yeah.
So what's your take on vampire facial, Hollywood facial, hypho, and please tell us.
So honestly, if you ask me about the expense factor, these are procedures that will help you probably lifelong, right? As if you're doing any procedure that's stimulating collagen, that will help you keep looking youthful over the years. Of course, you do have to repeat the procedures, not that you do it once and expect to look young forever.
Yeah.
But then again, you bring in the factor of skincare. I've realized people are spending so much on skincare right now. If you actually add up all the products you have,
right,
you
agree.
could, in a period of month, I've heard of people spending anywhere from 10 to 20,000 as well. Kuch
Agree.
ad aaya, discount mila, to le liya. Right? So I would say that rather than that, up apna basic skincare rakho, and along with that, some one in-clinic procedure every month. And there are procedures of all ranges. So vampire facial is usually within a decent budget. Okay. It just all we have to do here is we take the blood sample, take out concentrated platelets, inject them into the face. If you're someone a little scared of injections, they can be microneedled. So it's done with numbing cream. So when you do microneedling with the PRP, you actually don't feel any
Pain.
pain or
Yeah.
sensation like that, but it would stimulate collagen. It would help with glowing skin, evening out the skin tone. And even if there are any like enlarged pores or acne scars, it would help with that too.
So after what age you advise all these procedures?
Honestly, our collagen production is the best in our 20s.
Okay.
So there's a misconception that if you're in your 20s, you're too young to get anything done. I actually think it's the other way around, that when we start a little bit, I'm not saying that every month come in and do a vampire facial in your 20s, but if you start a bit in your 20s, it actually helps to stimulate collagen, which is the best in our 20s. And that would also help you in the long run, because anti-aging is exactly that, right? It's anti-aging. Aging ho gaya to usko hum reverse nahi kar rahe. We're trying to slow down the aging. And
Right.
aging is starting in our 20s.
But I think nobody wakes up in 20s, and once they are in their 30s or late 30s, when they start getting wrinkles, that's when they are awake. So what should
I
we
sorry, I also think that's very subjective again. That, you
Okay.
know, I've seen people in their, I've had people in 40s and 50s and come say, doctor, हम retinol क्यों use करें, हम young नहीं है इसलिए, anti aging है तो हम तो काफी young है. And they mean it, you know, they'll be like, I'm too young for anti aging. So I think it's very subjective and relative, and it's more about how you feel. जैसे कुछ लोगों को बिल्कुल bother ही नहीं करता. There are people in their 60s and 70s who are very happy with the way they look.
Right.
You know, they're fine with wrinkles, sagging skin, or maybe they don't have so many wrinkles compared to their friends, so they think they look very good.
Yeah,
right? So I think it's very subjective, but medically speaking, collagen production is the best in your 20s. So if you can start, then great. You know, late 20s is a good time to start thinking about it. If you're in your 30s, vampire facial is a great way to start, because it's something like your own blood, nothing external. So this is a good option. HIFU is a great option because, again, non-invasive, उसमें कोई injections नहीं होता. It's just a type of ultrasound technology for lifting and tightening.
Right.
So that's a great option too. If you're up for it, fillers also again great, because जितना आप जल्दी start करोगे उतना आप उसको थोड़ा सा अच्छे से maintain कर सकते हो. और जितना आप late कर रहे हो तो फिर, you know, there's a limit to how much can be corrected.